We have been collecting patient level data at that time, for more than 10 years. And we had identified that our system was outdated in two main ways. It wasn't moving fast enough, I guess three main ways. It wasn't moving fast enough for us. We didn't have the level of granular data that we needed stored to be able to do some of our new ideas in the future. We were just collecting results, but not like patient level. So we couldn't go back to the well and ask new questions. And then third, we didn't have great access to the data itself. We had to do everything through a vendor and didn't have necessarily the tools if we had a quick question of the data. So our challenges were we couldn't move fast enough, couldn't ask new questions of our existing data, and we couldn't do it ourselves. We knew some of the actual key people at WellStack at the time, and they had a reputation of being partnership oriented. That was a word we talked about a lot in our initial explorations of moving to a different partner. So WellStack had stepped forward as being really thoughtful about the types of investments they would put in place. Knowing that we were a unique entity in of ourselves, we wanted a partner that was designing a solution that would meet our needs, not just a vendor who would say, well, what do you want, and give it to us. So that partnership was important to us because that meant there would be new ideas and new visions set forth by the vendor as well. It wasn't a vendor-client relationship as it was a partner. So that was the most important term we talked about when evaluating a new vendor, was that they actually operated more like a partner that would be pushing us to new ideas, new business ventures, new opportunities for us, and putting those things in front of us, as well as willing to be nimble in what they created. So there's no organization exactly like ours anywhere. There's no roadmap that they could just follow and implement something. So we needed an organization that would customize the solution that we asked for and be continually innovating. So when we met WellStack, those were the characteristics they really led with. That word partnership was like in every meeting and every conversation, even before we were thinking about switching to a different platform. We heard about being partnership. They seemed to really understand our business and had big ideas that would help us strategically in the future. And then as we got into actually working with WellStack, the idea was we didn't know exactly what tools we needed, but we needed them to try something, create something new, be really nimble and thoughtful about that. And that's what they did. Well, our platform is a centralized place for really disparate data to live. And so our interaction with the platform is when we are interacting with it, it's very standard, and the fields all look the same. It's all as if it came from the same source. So that's our interaction with it. In reality, we know we're bringing in data from different EHRs, different organizations, different submission methodology, all of that stuff. I always talk about it being the magic that's happening. I really don't see it or have even a deep technical understanding of how that magic happens. What's important to me is I know it's coming from all these places. We often say we are EHR agnostic, but we're really even submission method agnostic. You can submit it to us any way you want. And so as a client, our interaction with the tool is after it's already been cleaned and processed and prepped. So we're interacting with really standard fields and tools, and we don't have to navigate between different custom codes that all of these organizations are needing. We just don't even see that on our end unless we really wanted someone techie on our team could certainly dig into it, and I'm sure they do with our WellStack partners. But as a user of the tool, we're looking at clean data that is apples to apples comparisons, and comes in a way that we can do what we want as an improvement organization, is we want to figure out who's doing well and who's not. So the platform, that standardization of the data takes away a lot of the noise that interferes with what we need to do for our mission. And we're able to just see what are the differences between the patient outcomes or the care processes between our participating providers. So we know the important differences, and we're not looking at differences in how it was documented or what EMR it came from. We're just looking at what actually happened and what are the outcomes for the patients, and that's all standard for us, which is extremely helpful in our work. We get asked that same question. We're a membership organization, and our members sometimes ask us for what's the ROI. And It's a question that I don't even think we should answer because as a membership organization, or even try to answer, because the returns that we're working on are benefits to patients who are living longer, healthier lives. And the amount of time it would take, so we do measure this. We do look at, how much we've saved, but that's what our mission is. And so answering whether we've been effective and provided a return to our customers and whether WellStack has provided a return, I don't think is even the right question. Um, I don't know how you quantify the return. If we really wanted to, and we look at, okay, the knowledge that we've increased on patients with diabetes and the cost savings that Wisconsin has made, and I truly think that is related to the incredible work that our state has done on diabetes because they have knowledge about the population, I can easily come up with a number that is far higher than our costs for the WellStech technology. I think, though, it's the wrong question to ask because our returns are about populations and people. But if you do look at Wisconsin and you look at the quality results we've been able to achieve compared to almost every other state in the nation, it is obvious that we're doing something right. And we believe that's because we have robust data that tells us where to focus our limited resources. So when we're looking at our state, we know because of the data we know down to the patient, census tract, zip code, you name wherever we want to look. We can look by some social determinants of health, race, ethnicity, age, gender. You pick any strata we want to look at. We can tell who actually needs the intervention. And that's priceless. I mean, truly, that's how we're going to save money in healthcare. I think short term, you look at the cost of any data, it's expensive. Long term, yes, it pays for itself, but we don't spend a ton of time trying to justify an ROI. Instead, we just talk about the outcomes our state has. And if you compare to other states and if you run analyses, which we do using our data on cost avoidance as a state, we are definitely saving 10, 20, 30 fold what we're paying. It's not even really a quantifiable number compared to what we're paying WellStat currently. But I truly think that's because of the data. I know it's because of the data we have. I mean, we've shown and we've measured improvements in outcomes. The reason I really hate to talk about it is because healthcare is expensive and people, unfortunately, are increasingly getting older and are unhealthy. And you could spend an entire career trying to justify spending money on the right people. But we're trying to move too fast to worry about that. But a lot of our work is on avoided costs and the numbers that in just a couple of years, Wisconsin health systems are savings are in the billions of dollars. Looking at it another way, if they weren't putting these quality interventions in the right places because of the data they have, we would be having significantly sicker people and spending a lot more money on healthcare in our state. Yeah, Wisconsin with WellStack has a really unique resource. And when I talk to other states about why they need a resource like this, it really comes down to having the right data, not just all of the data or more data. There is a real initiative. I think I mentioned this before, every conference I go to, the vendor rooms are increasingly filled with organizations promising to provide more data. And data alone is not information. It's certainly not knowledge, and it's not always actionable. What we talk about is you want to have information about as many people that you serve as possible, not necessarily every piece of data on them. You need to have the right information on the most people. And what that means is that you need to be able to get data from a lot of places. And so, you may have a competitor organization that has used AI to scrape a ton of detail on a very small population, but then you're missing people in your state. And we know that traditional quality improvement oftentimes exacerbates disparities because the people who can answer the phone are the ones that are going to get the quality intervention or that are already coming into the doctor. So number one, I tell them you want to be able to get data on a broad population so that you're actually talking about the people you're trying to help, not just theorizing. And some of the competitors might talk about being able to bring in multiple data sources, which WellStat can do. They can bring in data sources from a lot of disparate places, but I want to invest my money first in having a broad view of the population. And that requires being able to ingest data from really disparate systems, and it's very complicated. It's really easy to bring data together from the same type of system. So if you just pull from all the same EHR and those are only the groups you look at, that's easier. But when you start to have to look at bringing in data from systems on a lot of different EMRs that submit it in a lot of different ways, that's really difficult. And we needed a partner that could do that. The other thing that you need, though, is every state is unique. Everyone's capability to use data. You do need a nimble partner that can build solutions custom to you, and it can do so quickly. So having this organization that's thinking about what is the next tool, what's the next innovation, what do you need to achieve your priorities is important. And that requires a personal relationship. We know our WellStat team really well by name. They know us. We have dedicated support and partners. And while there may be bigger organizations out there that sound impressive because they have more people, you're going to lose that personal connection where they actually know what it is you're trying to accomplish. And a off-the-shelf solution, while you want structure and you want standardization, you need an organization that has that, but is willing and capable of innovating. And I don't know how you can do that unless they actually know who you are on a personal level. If every time you call, you're in a call center and it's being dispersed to a bunch of people, you're going to lose the ability to quickly describe a problem. And so I do talk to a lot of our other states about what we have here. They're always surprised at the level of data Wisconsin maintains, as well as our ability to use it and drive new innovation. So I tell them, look for a partner that isn't just saying, oh, I can get big data, but a partner that's thoughtful about what that means. And that if you're like WCHQ, that means you need to get data on a lot of people from a lot of different places with different resources. And then a partner that can do that plus innovate, whether that is layering in other data sources, like geographic data sources or area deprivation index or whatever it is you need to solve your problem, but not a one size fits there, because then you're going to lose that connection to your overall core business. So if you can find a partner like WellStat that'll sit at the table with you and not just show you the solution they have, but work with you to design a solution that achieves your overall mission, then I think you've got the right partner, and that's what worked for us.